Power to Practice. During today's training session, we are going to go through patient ordering in Power to Practice. In the patient's chart, on the bottom left-hand side, you will see our ordering menu. We're going to start by going through lab test. Here you will select the lab you'd like to create a requisition for.
By default, today's date to draw will populate, billed to patient, as well as any diagnosis codes that are in the patient's chart.
For this lab company, the commonly ordered tests have already been configured. They can be selected from this list below, or you can use the Search Lab Test box to search for the test. Once you have all of your tests in, you will have two options. You have a save option to save a draft of this order, or you can create the requisition by clicking Order. When we order, it will open up in a PDF form our lab requisition. By default, these lab requisitions are going to be visible to the patient in the document section of their portal.
After you select Order, you will see them pull up at the top under Pending Lab Orders.
Scrolling back down to our ordering menu, select Diagnostic Test.
Here you can search by CPT code or test name.
If your practice is already configured, they're commonly ordered. They will appear below here. You will then be able to select if it is being done in or out of the office. You will be able to add in any notes for the imaging center to refer back to. You will also be able to select any of the diagnosis codes you want on that requisition. Just like our lab test ordering, you'll have two options. You'll have your save and your order option. When you click order, it will ask which test you would like to order. Then click order and the requisition will open. Just like our lab test, these requisitions are going to be visible to the patient by default in the document section of their portal.
The next item on our ordering menu will be medications.
When a patient is on their questionnaire on the portal, they will have the ability to put in their medications. When they do, it will pull in as a patient modified medication for the provider to check and accept or reject into Power to Practice. You will then see the medication pulling over under current medication on the left-hand side.
All medications will need to be accepted or rejected prior to completing the chart.
If you need to add or update any medications, you will be able to search for medications or compounds down below. If you are putting in a medication list that a patient has brought in, you will be able to backdate the start date, as well as select Don't Fill to add the medication as current medication without filling it. To search for a medication, click the search bar and type in the desired medication. Select from the drop-down, add in your concentration and unit, as well as your SIG. Below you will have your quantity, day supply, refill. You will also have the ability to check off if it should be dispensed as written. When ordering through Power to Practice, if a patient has put in their preferred pharmacy, it will automatically pull here below when Fill at Pharmacy is selected. You have the ability to put in any notes that need to go to the pharmacist as well, and then click Save. When we click Save, the system will ask if you want to save this SIG into the master data for this medication. It will then appear on the left-hand side under medication. To then fill that medication, scroll to the top and select Fill Medications. Here you will be able to select the pharmacy, if it's print or fax. Then click Order. The last section in medication is down at the bottom under Medication History. Here you will be able to discontinue any medication they are no longer taking. When you do, it will clear out of this window here and on the panel on the left-hand side, but you will have a filter that you can change to view all medications. It will separate out standard and compounded medications. The next item on our ordering menu is supplements.
Similar to our medications, we will have our patient-modified supplements where they can be accepted or rejected into the chart in Powered to Practice.
In the Order Supplement area, you will see it pulling over here because we chose to add it to the current order. Supplements, commonly ordered, and categories need to be created on the user level. You can configure your commonly ordered and supplement categories by clicking on the Supplement Admin menu button below to set up your commonly ordered categories as well as any default instructions. You can also save commonly ordered supplements on the fly. If you search by both brand and product, you will be able to select from the drop-down list. In the case of inventory management being turned on, you will see the brand in red. If not, it will be in blue. It will then pull to the top for you to put in any instructions. If it needs to be with food or on an empty stomach, and then any notes you want to add. When we click Save, it will ask if we want to add these two items into our commonly ordered list.
It will then be visible on the left-hand side under Current Supplements. Similar to medications, we will have supplement history below as well, where you can discontinue any supplements they are currently taking.
Next on our ordering menu, we have referral. When we're looking to create a referral, it will be searching from your contact list. You can build out your contacts in the upper right-hand side in your menu under My Contacts. Once a contact is in the system, you will be able to search for them here. You can set the expiration for how long the referral is good for, or how many visits. You will then be able to add in any consultation details. You can click to sign the referral and then save and print. This will open in a new tab for you to review before faxing it over. This is also going to be visible by default to the patient in their portal, so they can print off the referral themselves. You will have a referral history section to see any active or inactive referrals for each patient. To fax over the referral, navigate to the flyout menu for the patient and select Documents. Here you will be able to select which documents you need to fax over, and then click Fax. Here you will be able to select the subject as well as the individual you are faxing to. If your contact had already had the fax number added in, the fax number would populate when the contact is selected. If not, you can type in the fax number Once you have the subject in, you can click Send Fax to send it over. If we navigate back to our patient ordering menu,
let's select IV injections and vaccinations. If your practice has already built out your IVs, you can search for it here.
And select it from the drop-down.
When you do, all of the preloaded information you have saved will pull over for you automatically.
Anything here with a star next to it will be a required field. When you're adding in the person who mixed and the person who administered the IV, it will be searching from the staff list. You will select the start time. The upon removal section here is optional. Upon hitting save, it will open a PDF document with the summary of the IV appointment.
By default, these are private and stored in the document section of the patient's chart.
They can also be found at the bottom under IV therapy, vaccination, and injection history. If you are doing an injection, below details, select injections. Again, anything with a star next to it is going to be a required field. Upon hitting save, a summary of the injection will open in a new tab. The same as the IV therapy, it will be private by default, and it can be viewed either in the history section or in the documents of the patient's chart. Our last item in the patient ordering menu will be your image charting. Select the template. If your practice has already set this up, you will have your templates and all of your products pulling over on the right-hand side. You will then click on the face or the image template to add in your injections. If you need to change the amount, highlight and type over the amount that you've added in at each injection. When you're completed, select Save All Data.
You will also have access to a photo library where you can upload a photo of the patient and use it as a template.
When you're done with all of the charting and ordering for the patient's appointment, you will want to complete the chart.
Do you want to generate a note, a medical note, or a separate note and medical note?
If you're generating a note only, that will pull any notes taken in the notes or quick notes section of the patient's chart. If you want to pull in other areas of the appointment, you will want to select Generate Medical Note. If you'd like a copy of both what you've taken in the notes section, in addition to the medical note, you can generate separate notes and medical notes. For training today, we are going to generate a medical note and select Proceed. Here you will be able to select what sections of the patient's appointment do you want to pull in to that final summary note for yourself. Some of these are coming from the patient's questionnaire. So if they are active on their portal, you'll be able to pull in any changes that have been happening to their patient's chart. If you wanted to preview this document, you can select Edit and Print. For today's training, we are going to select Complete. Here you will see the completed medical note document with the day and time of dictation as well as the signature displayed along the bottom. By default, these medical notes are going to be private, and there will be a section for medical note history as well as it's stored in the document section of the patient's chart.
To set your preferences for what is included by default within the medical note, navigate to your menu, hover over Admin, and select Medical Note Preferences.
Here you'll be able to favorite which sections are included by default, as well as you can drag and drop these sections in the order in which you'd like them to appear within the medical note. This change is done on the user level and will auto-save. This sums up our third training session for Power to Practice. You can go to our Power to Practice Training Center to view more videos, or you can reach out to your Customer Success Manager or our practice support team if you have any additional questions.